Today, nearly 60 different medical groups issued a joint statement calling for mandatory vaccine requirements for all healthcare workers in the United States. For many groups on the list, it was the first time they had made such a public endorsement of mandating vaccines, but their reasoning is clear. They write, quote, as the healthcare community leads the way in requiring vaccines for our employees, we hope all other employers across the country will follow our lead and implement effective policies to encourage vaccination. The health and safety of U.S. workers, families, communities, and the nation depends on it, end quote. Joining us now is Dr. Rachel Villanueva. She's the president of the National Medical Association, which is one of the nearly 60 medical organizations that signed on to the joint letter recommending a vaccine mandate among healthcare workers. She's also an assistant professor of obstetrics and gynecology at the NYU Grossman School of Medicine and a member of the medical advisory group of the Black Health Trust. Dr. Villanueva, thank you for joining us this evening. Your response, first of all, to this new news of the Department of Justice issuing an opinion to say it would not be illegal, in their opinion, for businesses and organizations and employers to issue a mandate.
Thank you for having me. I think it's such a great piece of information in our arsenal against the COVID-19 virus to have this information. It is critically important that we encourage all members of society that are able to get the vaccine to get vaccinated. It's really the only way that we're going to surmount the pandemic.
Well, I mean, it's kind of interesting, right? We're at, let's just put up the CDC's latest numbers on vaccinations. The percentage of the total population that is fully vaccinated is just under 50% right now, 49.1%. You can see the second line right to the right side of the screen. Dr. Villanueva, are you surprised that we're bumping up against this level of resistance? Is this what you would have expected?
I'm not surprised. I'm disappointed, but I'm not surprised. I think we have had a lot of it's been politicized to get the vaccine.
I have trouble with that one, too.
And there has been just so much misinformation around the vaccine. And I think confidence in the vaccine is not very high. And so I'm not surprised. I think it's not unusual for any individual to have concerns about taking a new medication or a new vaccine. But it is critical that we encourage all members across America who are able to get the vaccine to get the vaccine.
You are an obstetrician and a gynecologist. You are in the business of dealing with people's fears about medicine, what they don't know about medicine, and doctors in theory should have a great deal of empathy for people. How do you blend the empathy that you've got for people who are fearful, maybe subject to this misinformation about the vaccine, with the fact that it is affecting the rest of us? We are actually seeing another wave of COVID coming back because this virus is spreading the way it is amongst unvaccinated people and affecting those of us who are vaccinated.
I think it's very simple. I think it's being a doctor 101 or being a healthcare provider 101. You really have to listen to your patients. It's not, you can't really beat them over the head with the information. I think you have to meet them where they are. You have to help educate them. You have to validate their concerns and walk them through why it's so important. And at the National Medical Association, our patients are primarily the underserved, marginalized, and under-resourced populations whose vaccine rates are significantly lower than the general population. So for our organization, it was so important for us to sign on to this statement so that we could encourage our own patients to take the vaccine.
I've written down the words so that I say it right. The politicization you were talking about the vaccine. Masks were politicized before there was a vaccine. And now Dr. Fauci is suggesting that revised mask guidance is under active consideration. Fauci said on Sunday that revising mask guidance is part of the discussion. The taking off of the mask in places where people are vaccinated felt like a return to normalcy. Do you think we might have to go back to everybody being masked?
I would definitely leave that up to the experts. What I will say is that we see a return to normalcy, but now we're seeing a surge and a return to what we saw last year, and increased cases of COVID-19, hospitalizations, and deaths. Over 90% are in people who are not vaccinated. So as far as the vaccination, we encourage all that are able to get vaccinated, and whatever mitigation strategies we need to do to surmount the pandemic and the COVID-19 virus, we will do. If that means that the experts decide that we need to continue to wear masks, or vaccinated people need to start wearing masks again, then I think that's what we need to do. I think nobody wants to live through the trauma that we lived through last year, and the number of deaths we lived through. So whatever we need to do, we'll do.
I think that's the right attitude. Dr. Rachel Villanueva, thank you for joining us. Rachel Villanueva is the president of the National Medical Association and clinical assistant professor of obstetrics and gynecology at the NYU School of Medicine. And I managed to say that properly the second time.